This segment of Delmarva Life is brought to you by TidalHealth.
It is no secret that cancer can take a toll on one's body. If you or a loved one has ever been diagnosed, you know it all too well. You also know what it does to one's mind and soul, and that is why social work plays such a huge part in patient care at TidalHealth's Richard A. Henson Cancer Institute. I'd like to introduce to you this afternoon Lisa Barnes. She's a social worker for the Institute. Thank you so much for joining us this afternoon to talk about this.
Thank you for having me.
So let me ask you this real quick, just so that I have an understanding. What is your role with the patients?
We have many, many roles, but basically we provide support and encouragement to patients. And then we do it through a variety of ways. One can be just simply talking to them. Another can be giving them a call on a regular basis and seeing how they're doing. So
what you're telling me then is it's not just physical care, but it's mental and spiritual too.
Yes, and then some practical needs too. We're able sometimes to help with, gas cards, because the price of gas today.
Yeah.
And so we're able to help with that. And then we find all kinds of different resources. We also do support groups, and we do individual counseling.
Why do you feel it's so important to take care of all of the patient?
Well, I'll give you an example. I met with a lady who was so nervous about chemotherapy that she was getting hot and she was having palpitations and everything. So I was sitting with her and I rubbed her hand and just talked to her and had her do some deep breathing, and she calmed down. So, a lot of the symptoms that she was having from the chemo were actually self-induced. So just talking to her, that really helped. You can't treat a patient without looking at all of who they are.
Right.
There's some people are trying to work while going through cancer treatment. Some people are stressed about how are they going to get there. So you have to look at the whole person.
So you mentioned gas cards. What other kind of resources do you have that you can bring into play?
We look and we have a list, and we're fortunate to have several little grants that we can use. So sometimes we can help with bills. Then there's other big organizations like the Lymphoma Leukemia Society that we are partner with, and they provide help with transportation, help with some co-pays, things like that.
So how, and I'm going to, because I wrote this down, there's no way in the world I was going to remember these words. How does the Richard A. Henson Cancer Institute's multidisciplinary approach set it apart from other cancer care centers?
Well, we're fortunate. We work with a lot of healthcare professionals and a lot of good healthcare professionals. So we're part of a team of doctors and nurses, and my job is to say, okay, how good is this 87-year-old? Is this person able to get around? Do they have family support? Do they have a way to get here? That sort of thing, to kind of listen for what isn't said, so we can help those patients get here for treatment.
So you're not just helping the disease, you're helping the patient.
Right. Yeah. I would like to add we do have a great partnership too with MAC, and we do support groups. We do seated yoga. We do Tai Chi, we have cooking classes, and a variety of other things that our partner offers at their space, and we help with those things.
Oh my goodness.
Yeah, we have a lot of resources, people just don't know.
Just don't know yet.
Yeah.
Need to talk to you, find out more, huh?
Oh yes.
This is Lisa Barnes. She is a licensed clinical social worker with TidalHealth's Richard A. Henson Cancer Institute. Thank you so much for coming in this afternoon.
Thank you for having me.
Wonderful talking to you.